Okay, at the outset, thank you, Dr. Jyoti, and the entire organizing team for making me a part of this wonderful academic platform. And I must say, we've learned so much till now with all these talks that there is so much potential to imaging as far as management of breast cancer is concerned. It's not only diagnosis, but we can actually play an important role in the management of breast cancer. So today I will be presenting this abstract, which had been presented in the San Antonio Breast Cancer Symposium. And it was a study which was conducted at Seattle Cancer Center by Dr. Kaizeroni et al. And the study was titled as the Associations of Baseline Breast MRI Matrix and Immune Infiltration with Chemotherapy Response in Triple-Negative Breast Cancer. So in this study, they have tried to evaluate not only the MRI matrix, the MRI radiomic parameters that can help us assess the response to neoadjuvant chemotherapy, but also they have included the degree of tumor-infiltrated lymphocytes obtained during the biopsy specimen prior to the treatment, which has already been found to be a prognostic indicator. Also, an important part of this study is that this study reads only the baseline MRI characteristics. They have tried to evaluate the first pre-treatment MRI that was done to identify the radiomic features of the pre-treatment MRI and escalate it to predict the therapy the response to chemotherapy. So the background of the study goes as improving the prediction of neoadjuvant chemotherapy response in early TNBC would provide the opportunity to consider adjustments to regimen prior to initiating the therapy. The degree of tumor-infiltrating lymphocytes prior to treatment is prognostic, and the dynamic contrast-enhanced MRI of the breast matrix enable a non-invasive assessment of the tumor microenvironment. The aim of the study was to investigate the value of pre-treatment MRI matrix in addition to the tumor-infiltrating lymphocytes for the prediction of NAC response in TNBC patients. The patients were between stage 1 to 3 of triple-negative breast cancers who had undergone a pre-treatment breast MRI and received chemotherapy, approximately with a total patient number of 115. The MRI parameters which were included were from the non-contrast MRI diffusion-weighted images, that is the mean ADC, and from the dynamic contrast-enhanced MRI, they used the tumor longest diameter, the peak percentage enhancement, the peak signal enhancement ratio, and the functional tumor volume. I'll just elaborate on all these parameters. The tumor longest diameter, as its name suggests, it is the longest dimension on the first post-contrast image. The peak percentage enhancement is the percentage increase in the first minute contrast study. The peak signal enhancement ratio was the signal enhancement in the early and the delayed phases, a ratio of that. And the functional tumor volume, which has been derived, there have been several studies on that, in which they have fixed a threshold of the signal enhancement ratio. And all those boxes which are showing an enhancement above that signal enhancement ratio threshold were considered for the functional tumor volume. The immune filtration or the TILs were identified from the diagnostic biopsies, and it was available only in 60 patients. And the response, a pathological complete response at surgery, was taken as the endpoint. So, and what they found was that the pre-treatment TILs, as you can see here, they were significantly higher in the PCR patients. So all those patients in whose biopsy specimens the tumor infiltrating lymphocytes were higher, they achieved a PCR. pre-treatment TLD, as you can see here, was significantly lower in the PCR patients, as in the whole cohort, as well as T1 and T2, whereas in the higher stages, the TLD was not significantly predictive of the response. A pre-treatment functional tumor volume was also found to be significantly lower in the PCR patients. As you can see here in the PCR for the whole cohort, the patients showing PCR had a significantly lower functional tumor volume, as well as in the T1 and T2 group, but it was not the same with the higher stages. Similarly, the pre-treatment peak percentage of enhancement was significantly lower in the PCR patients again. And when they combined the data from the DCMRI and the tumor infiltrating lymphocytes, they found that the AUC curve for the whole cohort, as you can see, in whom the TILs were available, there was an improved AUC from 0.62 to 0.67 if they included the peak enhancement, and if they included the longest diameters, the AUC improved to 0.76, which means that if we combine the TILs and the MR imaging parameters, there is an improved area under the curve. These are just few examples which they have shown in the abstract about the peak enhancement maps. As we can see here, this is a T1 and T2 stage tumor in which with the complete pathological response in surgery, and if you see this pre-treatment MRI, the parametric map shows lesser enhancement. There are more blue areas and green areas as compared to the non-PCR, in which the peak percentage enhancement parametric map shows a higher PE. This is an example for the T3 and T4. Well, the PE was, as you can see, is not very predictive. This is a necrotic tumor, and this is a large tumor with a lot of red areas, large and peak enhancement. So what they have concluded from their study was that these baseline dynamic metric parameters like the tumor size, the functional tumor volume, and peak enhancements, and if immune filtration added to them, were strongly predictive of neoadjuvant chemotherapy response in triple negative breast cancers stages T1 and T2. There were no imaging metrics which reached significance in T3 and T4 patients. Even the signal enhancement ratios and ADC did not reach significance in either of the tumors in their study. In future work, they intend to evaluate these changes in imaging and pathology metrics over the course of neoadjuvant chemotherapy to predict response. So this is how the response with chemotherapy would appear on a parametric map for the peak enhancement percentages. This is the baseline, mid-treatment, and the pre-surgical. As we can see, the enhancement has, there is not a complete response, but the enhancement has definitely gone down drastically. Thank you.